I've been a nurse for 10 years, but these are some things that I wish I would have known as a new grad. Number one is nursing is a 24-hour job. There are going to be days where you cannot physically get to everything that needs to be done. You have to be okay with that. You're just one person and you're doing the best that you can do. And sometimes the workload is just so much that you're not able to get everything done and you have to pass some things off to the next shift. One thing that has helped me with this is writing down all of the tasks that I want to accomplish and then figuring out what needs to be done right now, what needs to be done in a little bit, and what can wait. Number two is you are not going to save everybody. When I became a new nurse, I wanted to save the world. I had this mentality that I was going to help everybody, change everybody's lives, save everybody. You have to learn to show up for people where they are currently at. People are allowed to make the decisions and choices that they want to make, and we can provide the best care, the best education, and ultimately, patients are going to leave the hospital and do the things that they want to do. It can be very morally defeating and draining when you are putting so much effort into somebody that you know is going to leave the hospital and make bad decisions. But at the end of the day, people are allowed to make those decisions, and it is our job to show up, provide the best care for people, educate people, and you never know when you are going to be that nurse that maybe makes that difference in their life, that changes their perspective, that changes how they want to live their life. But at the end of the day, you can't carry that weight home for you if the patient doesn't go the direction that you were wanting them to go. Number three is when a patient dies, it is not your fault. You are not the reason why the patient came to the hospital in the first place. You are not the reason why the patient got worse. We can do everything right for a patient and they can still not have a good outcome. Number four is you are not going to make everybody happy. Patients, doctors, coworkers, etc. Sometimes you have to be the bad guy. Sometimes you have to be that person that calls a doctor at 3 in the morning and pisses them off. Sometimes you have to be the one that tells your patient, sorry, you can't have anything to eat or drink because you have surgery in 2 hours. And they yell at you and they're mad at you. You have to learn not to take certain things personally. You are not responsible for how people react to the information that you give them. And number five is your nursing friends, your coworkers are everything. They are the ones that are there with you day in and day out and understand the things that you are going through. I have a few close friends in my life that I like to debrief things with whenever I see things at work, and just talking about it and sharing it helps so much. We see a lot of traumatic things as nurses that the average person should not witness on a day-to-day basis. It's okay to not be okay at times. So take care of yourself from day one. Have a good support system, have good coping skills, have good work-life balance, and how you take care of yourself outside of work. And if you want me to share more on that, I'm happy to.